It's the people. I work in the emergency department, and we have a great experienced group of physicians, nurses, staff that are really committed to providing excellent care.
As the youngest of two brothers, I spent a lot of time trying to keep up with my older brother, sometimes successfully, sometimes not successfully. By the time I was 21 and graduating college, I had had over 85 sutures. The majority of these sutures were placed at Emerson in the emergency room, so I felt well acquainted with Emerson. When Ed Safe retired from the Concord Hillside practice and asked me if I'd be willing to come on board and assume his panel, I was more than delighted to reacquaint myself with Emerson.
So I really appreciate how Emerson has developed their outpatient facility and really made it a pleasant experience. And I always ask patients when they come back to my office as a surgeon how your experience was at Emerson. And almost universally they're amazed. And most patients have been at other hospitals and they didn't know how great Emerson was. And so I always get compliments on that.
When I came to Emerson, I started the retinal detachment service, and my first patient worked in the admissions office at Emerson. Fortunately, the surgery went very well, and she put many of my subsequent patients who had retinal detachments at ease when they were admitted for their procedures. I saw her for many years in the office, and now also care for her son. What has been a very rewarding experience for me is serving multiple generations of families throughout the years.
This patient came to me frantic because she woke up with a new rash on her leg. It was red, raised, and extensive. Well, on careful examination, I discovered that maybe it could be a fruit stain. So I took a 4x4, made it wet with saline, and I proceeded to dissolve the rash. Well, the patient was embarrassed, but very grateful.
Try not to play favorites, but I do have a patient who is now about 12 years out from a diagnosis that she was given a 4-month prognosis for. It also is a situation where I've got to kind of grow up with her, and it really taught me that it's really a huge privilege as a caregiver to be able to enter into people's lives, not just to give medicines and take care of their medical issues, but to become a part of their lives. And I think it helps to keep me grounded where being a physician really is a privilege. It's not anything other than that, and we're blessed as caregivers to get to know our patients, and we're blessed to have them feel comfortable getting to know us.
And the one that I find reflects personally is the opening of the new rehab and the sports center and the Cantu Concussion Center. With these two centers, our patients now have access to an incredible new facility. If you haven't been there, it's just beautiful. We're now able to offer to our patients evaluation therapy with a group of people who are experienced in working with patients with concussion and under a single roof. This is the only place in the Boston area where patients can get this type of care, and I think is a tremendous improvement to the care here at Emerson Hospital.
Emerson has happily managed to excel in all the ways a community hospital should. But in the core and essential ways, I don't think Emerson has changed all that much. There's a strong sense of compassion held by the doctors who come here, who attract other doctors who come here, but also in nursing and all the staff throughout the hospital.
In this time of great change in medicine, I would say Emerson is doing an exceptional job at not changing in a way that perhaps we would regret it down the road, but keeping at the heart of what we do here a patient-centered model where, again, humanity and compassion is at least valued higher than the other things that may be less important.
I like Emerson so much, my mother had her hip replaced here. So when you send your family members to the hospital that you work at, to me, that's a good sign.
Undoubtedly, my most memorable and perhaps most humbling experience was that of being an Emerson patient. We are fortunate to have several world-class hospitals in the Boston area. I could have gone to any of the big academic medical centers, but I chose Emerson Hospital for my surgical and oncology care.
My granddaughter Lucy was born at Emerson, and I think that's really the greatest recommendation about Emerson is that people who work here get their care here.
Everyone you work with, there's a strong sense of community at Emerson. And that's why I came here, and that's why I'm still here.